Hello, I hope all is going well. It is the start of Module 2, and I just wanted to point out a few additional things that I didn't mention last week when I did my intro tour video and we did our live class. There is just so much information that is available in this Blackboard course. It is extremely rich, and so I just want to make sure that you're aware of everything that's available so you're getting the most out of this class, and I can certainly answer any questions that you all have in live class on Thursday. So as you scroll down and you click on the modules, so first of all, we're going to go right into Module 2, okay, and then into the lesson content. Okay, most of this information I'm sure you've seen. It's the objectives that are there. The assignments are here along with some of the reading that is linked, but also don't forget these chapters 6, 8, and 9 are coming from your textbook, which is right here. It's the Gould's Pathophysiology for the Health Professions. The 6th edition. It's in Vital Source, and you should be able to access that. If you're having any trouble, please let me know. I learned last week that most of the issues were related to it was the first time having access to Vital Source, and so you have to register and make sure that you have your textbooks, your e-textbooks activated. Anyway, so your reading assignments are here. So you have your 3 chapters within the textbook, plus some additional websites for reading. And then it breaks down all the different activity times. If you feel like you're spending an excessive amount of time in any one of these areas beyond the allocated activity time, please let me know, and I'm happy to, again, help you through that content. But it kind of breaks down that, this week is about 30 hours of work. And that's specifically looking at a combination of all the readings and the activities on top of the assignments. So you still have your discussion board, your quiz, your case studies that you have to do, and then the live class lecture that you'll sit through. So as you go through the content, again, it's interactive. You can click on them to get more information. But I want to scroll all the way down. So again, there's a lot of information about infectious disease, about some different common infectious diseases, and it'll tell you the overview, the infectious agent, the mode of transmission, which I can talk about a little bit more in depth on Thursday if there's any question about mode of transmission. Vaccines. Different types of vaccines, whether they're live or inactivated, right? And what kinds of vaccines are out there. Obviously infection control. And then it goes into both the integumentary system and the musculoskeletal system. So there's some information where you can get an overview of normal integumentary anatomy and physiology and normal musculoskeletal anatomy and physiology before you move into here's an overview of symptoms right there before you get into abnormalities. Okay, so this, again, these are skin lesions. Some of them are not pathological from the perspective of they're not a disease per se. It might just be a skin lesion that's a normal anomaly, meaning that it's not infectious or it's not progressive or anything along those lines. On the other hand, there are other ones that it's not necessarily the case, right? And so pustules is a good example, that there's something underneath that, an exudate that's underneath that. Vesicles, same thing. There's exudate that's in there, but it's usually a fluid rather than a pustule that has an exudate that tends to be a little bit thicker. Plaques, ulcers, fissures, so burns, it goes through the 3 types of burns, diagnostic testing, and then for musculoskeletal, we've got diagnostic testing as well. And I'm scrolling all the way down because then we get to this disease chart. And this is something I didn't get a chance to talk about last week, so I'm hoping that you're going to watch your way all the way through this video and find this. Because when you click on this, it will bring up this chart that you can use to fill out as you're going through those chapters, right? And you're going through the information that is in the beginning. So I wanted to tell you now because I would love for you to actually be filling this out as you're doing your readings, because then this information will help you with your quizzes, okay? Really important, right? This helps you focus. There are so many different diseases that are out there. This is going to help you focus your reading and your learning on the different pathological processes in the integumentary and in the musculoskeletal systems, okay? So it goes through the disease. You'll fill out the etiology, signs and symptoms, diagnostic tools, treatments, complications, prognosis, and then you'll do that for integumentary and musculoskeletal, okay? If there are any questions about that, I'm happy to answer it on Thursday during live class. You can also feel free to send me an email or post any questions on the Padlet, and hopefully we can get those questions answered. But I just wanted to send this quick little video out to make sure that you know where to find this and the fact that it's really, really important to find it in order for you to be the most successful in your quiz. Okay. Then as you continue to scroll down, there are some patient profiles that will give you some information and help you to, it'll leave kind of a blank section, right? So this is kind of helping you identify signs and symptoms. It kind of tells you the diagnosis, the treatment, the prognosis. This is some information that you would want to put. There's only, I think, 3 patient profiles that are here, but it's helpful in giving you some information on, or giving you an idea of what needs to go into that chart, okay? Then as you continue to scroll down, we get some nice x-ray images of normal and fractures, okay? Then microscopy, specifically looking at, again, normal bony tissue versus osteoporotic. So there's much larger holes. It's thinner, weaker bone. Light microscopy, so x-rays of the hip showing you severe osteoarthritis. You can see that it's very cloudy, so this is what a normal hip should look like. And here you're seeing all this cloudiness in through there. That's osteoarthritis of the hip. And again, visual examination of melanoma, which is skin cancer, okay, so on and so forth. And this one's showing you an osteosarcoma of the tibia. So it's a tumor of the tibia. All right, so I just wanted to give you a heads up that all that information is there, and tons and tons of resources are available. And if you need me for anything, please let me know. All right, have a great one. Bye.